You know, sir, that in all those countries, all the developed countries that have single-payer systems or universal health care, happiness about health care is actually substantially greater than it is in the United States.
Then why do they all come here? Why do they all come here for treatment?
They don't all come here. Republicans say that all the time. They don't all come here. They don't all come here. People in Canada, people in Norway, people in the United Kingdom, people in Sweden, people in Denmark, they don't all come to the United States for health care. Why do you say that? I grew up in Canada. I live in Canada. My entire family's in Canada. Nobody I know ever came to the United States for health care. I'm sure you have a handful of stories about things like that. It's not actually statistically true.
Joining us now, Ali Velshi, MSNBC anchor and correspondent, covers business and other matters. And Ali, there I was Thursday morning, minding my own business, I thought, watching MSNBC. And you have this exchange that I think cut through more than almost any other interview has done in this season of interviews about this subject. And I just immediately called in here and said, can we get him to stay up late? We got to.
Always my pleasure, Lawrence.
A point you made, having grown up in Canada and knowing that system and looking at this from a global perspective, was to the Republicans has been simply show me one example somewhere in the world that is a free market health insurance, health care system.
There's no, not on this planet, there's no actual free market health system. And that's because no profit-making company would ever choose to willingly insure a sick person or an old person. They just don't do it. So the only way this works is as a risk pool. Now, the only way to cover as many people as you can with a risk pool is to do what most countries, most modern countries have done, and that is a single-payer healthcare system or a fully mandated system, not even Obamacare, one where it's not a penalty. Everybody has to pay into it. That's the only way you get young, healthy people to buy into a system that's actually relatively expensive. And over time, it all evens out. There's no such system. There's no rush for people to come to America where health care costs twice as much per person as anywhere else in the developed world. And that's the stuff that I just want to lay bare. I'm a business guy. I'm a capitalist. If you could show me a system where this actually works, an unadulterated free market system where the market handles it all, I would embrace it. But this is what we in business call a market failure.
Exactly.
Worldwide, it has never actually worked. Unless there's someone forcing everybody to get insurance, the private markets won't do it on their own.
Yeah, and even historically, free market economists have agreed that there are places where the market fails, and in those places you need interventions.
Often prisons, hospitals, and healthcare.
Education, public education. There are areas where if we left it to the market, too many people would be left out of a necessary public good. This is one of those. And that line about, well, if the Canadian system is so good, why are they always coming here for treatment? To hear you be able to personally answer that was so powerful.
They're not. And again, afterward on Twitter and anecdotally, I checked to say, am I out of touch because I've been living in the United States for a while? And everybody told me the same thing. No. There are, dotting the Canadian-U.S. border in places in Washington State and Michigan and upstate New York, there are MRI clinics, X-ray clinics, things like that, where if you don't want to wait to get your MRI and you're prepared to pay cash for it, you can do that. There's no real medical care that Canadians are coming to the United States for. And certainly, when it comes to prescription health, it's the other way around. Americans go to Canada, either online or physically, to get their drugs. So it's not a broken system. I'm not arguing that single-payer healthcare systems solve all problems. They certainly don't. But in all of those countries that I named in that clip, outcomes are better. Life expectancy is longer. Preventative health care is a bigger deal. But preventative health care doesn't work in our insurance model. We pay for services rendered. If you're actually going to denude the system of services that need to be rendered, the system falls apart.
Ali Velshi doing great work in this arena. Please be willing to stay up late.
Always my pleasure.
Occasionally.